nose, so the external internal ears, or the mouth will go into the nasopharynx, the oropharynx will go down into the laryngopharynx, and then we'll meet up with the larynx. And the larynx will then go into the trachea, which is this fun little blue tube in here. And there's tracheal cartilage, and there's the tracheal rings are made of tracheal cartilage. And was there something else? There's tracheal...
Trachealis muscle, but it's not there. It's in the larynx.
Okay, well, the rings, their purpose is to keep their C's. They're C-shaped, they're not rings, so they're just supposed to keep the trachea open while still allowing the esophagus to extend into the tracheal tube so that you can swallow larger objects. So, moving into the lobes of the lungs, so the right side is bigger than the left side because the heart fits right here inside this cardiac notch, which is this fun little side over here. So, with the right side, you have 3 lobes, which means you have 2 different lines. So you have the transverse line, right? And then you have the oblique line. Is it fissure?
Do we need to know the lines?
Thought we did.
We need to know the lobes.
I don't know the lobes. There's the superior, middle, and inferior. It's the
Superior, middle, and inferior lobe.
And then we have superior and inferior on the left. There's only 2 because it's smaller. So, opening up inside. Can't really see anything in here, so it's kind of useless. But, so you have your trachea, which will break into your primary bronchus, which will then split into secondary bronchi. So primary bronchi, secondary bronchi, and the secondary bronchi will then break up into tertiary bronchi, which will then break up into bronchioles. The bronchioles will then empty into...
That's it?
No, it'll empty into the alveoli. The little air sacs.
Okay.
Which one?
The bronchioles will empty into the alveolar sacs. Well, it goes into the alveolar duct first, and then it goes into the alveolar sac. That's kind of it for this model, because there's not a whole lot here. If they had a
Which is a pulmonary artery and which is a pulmonary vein?
Okay, the pulmonary, here we go, in here. So the pulmonary arteries are going to be the blue ones because they're taking deoxygenated blood into the lungs. And the veins are going to be the red ones because they're taking it out.
It's not artery and vein?
Okay, this is where the heart is.
Yeah,
so we're talking about these.
Well, my fault.
Because these ones here, these ones, it's really awkward the way that they shape this. Because this is the pulmonary artery, which will come into here. And then you have the pulmonary veins, which will come back in here. So, that's awkward, but yeah, that's what it is. Let's go home.